What if one habit people trust after 50 is quietly making their bodies weaker? Most adults over 50 believe they are protecting themselves by choosing only safe movement. They walk regularly, avoid heavy exercises, and stay careful with joints and balance. On the surface, that sounds responsible, sensible, and exactly what aging bodies should do. But here is the uncomfortable idea most people are never encouraged to question. Some of the safest routines may only maintain movement, not protect long-term strength. Weakness after 50 often comes from muscles slowly being used less, not aging. The muscles most commonly forgotten are the ones surrounding the hips and glutes. When strong muscles stop contributing, other joints quietly begin absorbing extra stress. Over time, this shift can affect posture, balance, confidence, and everyday movement quality. This video is not about blaming you or criticizing doctors or well-meaning advice. Walking is helpful, stretching is helpful, and being cautious absolutely has value. But what if those habits are only maintenance, not enough protection anymore? What if your strongest muscles are slowly shutting down while you think you are safe? Research in movement science increasingly links weak glutes to instability after 50. This connection appears across balance problems, back discomfort, and higher fall risk. Not because people failed, but because certain muscles stop being challenged gently. You can be careful every day and still train your body for weakness. That idea feels uncomfortable, but ignoring it does not make it disappear. The good news is, this pattern is not permanent or irreversible for most people. Muscles respond to use at any age when training is smart and respectful. After 50, the body rewards precision, control, and consistency over intensity alone. This video was created to show safer ways to rebuild forgotten strength. Not extreme workouts, not pain, and not pushing beyond your limits today. Instead, we focus on simple movements supported by physical therapy principles used worldwide. These movements are designed specifically for adults who want independence after 50. If staying steady, confident, and capable matters to you, this message is important. In the next minutes, you will see 5 carefully selected glute-focused exercises. Each exercise can be modified, supported, and adjusted for your comfort level. These are not trends, but foundational movements tied to real-life function daily. Standing from a chair, climbing stairs, and catching balance all depend on glutes. We will begin with the most approachable exercise and progress carefully together. Nothing here requires rushing, forcing, or comparing yourself to others, ever unnecessarily. Before starting, remember this content supports education, not medical treatment or diagnosis advice. Always listen to your body and consult professionals if you have concerns. With that understanding, let us explore why walking alone may be incomplete. Walking keeps you moving, but it does not fully engage powerful hip muscles. Studies suggest walking activates only part of the gluteus maximus during normal daily steps. That means large muscles designed for support are left underused much of the time. As years pass, unused muscles gradually lose strength and coordination without warning signs. This decline is quiet, slow, and often mistaken for normal aging alone. Weak glutes reduce hip support, shifting pressure toward knees and lower back. Over time, this pattern can increase pain sensitivity and balance hesitation significantly. Often pain appears only after the underlying weakness has progressed unnoticed for years. The empowering shift is realizing walking does not need to be removed. Walking can remain your foundation rather than the entire solution for strength support. Adding gentle strength work helps muscles walking alone cannot fully train effectively. This does not require heavy weights or aggressive movements to see benefits safely. It requires intention, slow control, and respect for joint safety throughout every movement. Let us begin with the first exercise, chosen for safety and real-life relevance. Step-ups look simple, but they quietly reveal real-life strength and balance capacity. Every stair, curb, or step tests your ability to lift body weight safely. Walking alone rarely challenges this one-leg strength pattern effectively over time. Step-ups train hips, glutes, and core to work together under control. This coordination is critical for stair climbing and preventing sudden balance loss. The key is moving slowly and letting the front leg do the work. Momentum hides weakness, while control exposes muscles that need support. Using a low step keeps joints safe while encouraging proper muscle activation. Holding a wall or chair is encouraged and improves confidence during practice. Pressing through the heel helps re-engage dormant glute muscles gently. Even small repetitions can restore strength patterns lost through years of inactivity. Consistent practice improves coordination, not just raw muscle force. What feels challenging today often becomes easier within weeks of repetition. Strength gained here directly transfers to daily independence tasks. This movement prepares your body for real-world demands safely. Glute kickbacks appear small, yet they retrain critical hip extension mechanics. Many adults unknowingly substitute lower back movement for weakened glute activation. This compensation increases spinal pressure and reduces movement efficiency over time. Kickbacks teach the brain to activate glutes without involving the lower back. Standing behind a chair provides balance while allowing focused muscle control. Lifting the legs straight back keeps the movement targeted and safe. Avoiding back arching protects the spine and isolates correct muscle engagement. Slow holds at the top improve neuromuscular awareness significantly. Research shows targeted activation improves walking confidence and balance stability. These benefits appear even without added resistance or heavy loads. Over time, posture improves as glutes reclaim their stabilizing role. Each repetition sends a signal reinforcing proper movement patterns. Small, controlled motions often rebuild strength more effectively than large movements. This exercise helps restore trust between your brain and hips. Better coordination here reduces strain during walking and standing. Lying down removes balance challenges, making this exercise especially joint-friendly. The glute bridge targets powerful hip muscles while keeping the spine protected. Many physical therapy programs rely on bridges for safe strength rebuilding. Proper form ensures glutes activate before lower back muscles engage. This retraining improves how the body rises from chairs and beds. Pausing briefly at the top enhances muscle awareness and control. Slow lowering encourages stability and prevents momentum-based compensation. Bridges strengthen the posterior chain, responsible for upright posture support. This muscle group often weakens quietly with prolonged sitting habits. Consistent bridging helps counteract years of underuse effectively. Research links improved hip strength to better mobility scores in older adults. These gains occur without aggressive loading or high-impact movement. Alignment matters more than height during each repetition. Optional supports help maintain proper knee and hip positioning. Repetition builds confidence in safe movement patterns gradually. This exercise teaches the body to generate force efficiently. Improved coordination reduces strain during everyday lifting tasks. Gentle progression supports long-term adherence without burnout. Comfort and consistency matter more than pushing limits here. This movement builds a foundation for all standing activities. Side hip muscles quietly stabilize every step you take throughout daily movement. When these muscles weaken, balance becomes less reliable without obvious warning signs. Many adults feel fine walking until subtle compensation patterns begin forming. Seated hip abduction targets these stabilizers in a safe, controlled position. Sitting removes balance demands, allowing focused muscle activation without fear. A light resistance band provides enough challenge without stressing joints. Pressing knees outward teaches hips to support proper alignment. Holding briefly at the widest point improves muscle engagement quality. Slow return prevents momentum and reinforces control. This movement supports knee tracking and pelvic stability during walking. Weak side glutes often contribute to knee pain and hip discomfort. Strengthening them improves confidence when shifting weight onto one leg. Even small improvements here can noticeably change walking comfort. This exercise fits easily into daily routines at home. Consistency matters more than resistance level or repetitions. This final movement looks advanced, but proper scaling makes it accessible. Supported split squats closely resemble real-life one-leg strength demands. Standing up, stepping forward, and stabilizing weight all use this pattern. Using support reduces fear while allowing muscles to work safely. Short movement ranges are acceptable and encouraged at first. Control matters more than depth or speed during this exercise. The front leg does most of the work intentionally. This activates glutes while protecting knees and lower back. Training one side at a time improves symmetry and coordination. Improved coordination supports balance during unexpected movements. Tight hip flexors often relax as strength improves gradually. This restores natural stride length and posture alignment. Avoiding this pattern entirely can limit functional strength development. Slow repetitions retrain the nervous system efficiently. Support tools allow safe progression without risk. Strength gained here transfers directly to daily confidence. This movement teaches your body how to handle imbalance calmly. Real-life strength develops through controlled challenge, not avoidance. What once felt intimidating becomes manageable through repetition. This is functional strength designed for everyday life. These exercises are not trends or extreme fitness challenges. They are foundational movements supporting independence after 50. You do not need to perform every exercise daily to benefit. Choosing one or two consistently creates meaningful change over time. Walking can remain part of your routine, not the entire solution. Strength complements movement rather than replacing it. After 50, the body responds best to precision and patience. Consistency matters more than intensity or speed. Small decisions practiced regularly shape long-term mobility. You do not need to rush or compete with anyone. Each repetition is an investment in future confidence. Independence grows from muscles working together harmoniously. Strength supports freedom, not pressure or fear. Trust in your body can be rebuilt gradually. The next chapter begins with intentional movement choices today.